Hi, I'm Dr. Raj Kakarla. I'm the Department Chair for Radiology at Mercyhealth and the Chief of Vascular and Interventional Radiology here at Mercyhealth. Peripheral arterial disease is a very common disease that affects majority of the population in America as we all age. After a certain age, we all have some degree of peripheral arterial disease. That means that there's some narrowing of the arteries in our body. And that becomes, happenstance due to cholesterol or plaque buildup. Just as we know in the heart arteries, plaque buildup and cholesterol buildup can calcify and cause blockages or narrowings. The same thing can happen in other arteries in the body, and most commonly in the arteries that go down to the legs or the feet. So most often, these are asymptomatic. So you may not need to present to your primary care physician, or it's not even diagnosed. However, there's some degree of narrowing happening. When it does become a problem is early on what we call claudication. That really is a fancy term by saying that you have pain on walking. Used to be back in the day called window walker's disease. As people went around shopping, they would have pain and they would have to stop at a window, and after they rested, it got better and they would walk on. Now we associate it with calf pain as you walk, so people can have reproducible pain after they walk a certain distance, and resting usually alleviates that. And that is a supply and demand issue with the arteries, because you're just not getting enough supply of the blood as the demand increases by exercise or walking. That is the first line, at which point you may present to your primary care. The rest of it, as it gets worse, people have pain at rest in their legs or feet. And the very worst end of the spectrum is when people have non-healing wounds, ulcers, or gangrene just because there's not enough blood supply that far distal to the foot or the toes. So we treat all spectrum of that, and each patient is different. And the workup initially involves what we call ultrasound or ankle brachial indices, using blood pressure cuffs to see if there's a difference in the flow to your foot. After that, the primary may directly refer you to our clinical service, at which point we may order an ultrasound to see how the blood is flowing, or a CAT scan to see how the blood is flowing down to the legs. At that point, we will make a decision on whether something could be treated minimally invasive or surgery, at which point we have a very multidisciplinary approach with our surgical colleagues here at Mercy.